My name's Lauren. I work for Medtronic, and tonight I have the pleasure of hosting this webinar where you'll get to hear from Dr. Jason Lomboy. He's a board certified urologist with expertise in overactive bladder and incontinence, enlarged prostates, and complex voiding dysfunction. He works at Advanced Urology, specifically out of the Marietta and Canton locations. Dr. Lomboy provides experience and compassionate care that you can expect from a top-notch physician. He has a special interest in treatments for overactive bladder and urinary urge incontinence, and he looks forward to discussing this in more detail tonight. And with that being said, I'd like to welcome Dr. Lomboy.
Thank you, Lauren, for that introduction. And thank you, everybody, for being here. I know it's not the easiest time of the day to join a webinar and talk, but I really appreciate your time, and I hope we can use that time wisely and relatively quickly here to kind of go over a very common series of problems, give you some background info, suggest some options for treatment, and then ultimately help get you in to see me or one of my partners to move forward with one of those treatments. And so with that, we'll get started. So, very few things in life are certain, but one of those things is that people do not like talking about overactive bladder. Many of them do not bring it up with their doctor, but it's a very distressing problem. These are several questions that you may have even asked yourself about some urinary symptoms you may be having. And so we're here to talk about that. In urology, we talk about a lot of sensitive topics, but hopefully because we do it every day, we do our best to make you feel comfortable discussing it with us so that we can create an individualized plan of care for you that fits your schedule, fits your priorities, and is something you can adhere to so that it works. One thing that is very common is I hear from patients is that, well, this is just part of life. My mother, my grandmother, my aunt, my uncles, my grandfather, they all had these problems, and it's just, part of age. It's not, it can be common as one gets older, but that doesn't mean it's normal. And so we're here to kind of help you assess whether these are similar symptoms you may be having, and if so, how we can help. So you are not alone. I would say that this is a major step for you to be here because admitting that there's a problem is probably the hardest part of this process. The second being actually finding time to come in to see me in the office. But you are not alone. This is a very common problem. 1 in 6 adults affected with bladder control, and very common as well with bowel control. Sorry. The good news again, we have options to get you back your life, get you back control, get you back the things that you enjoy spending time with, so that you're not avoiding those activities or limited. So just for some background, what causes bladder and bowel problems? It can be caused by a number of different things. These are actually just a few, for example, such as daily habits, what you're eating and drinking, whatever medications or supplements you may be taking, and then your history, history of pregnancy, childbirth, pelvic floor injury, accidents, prior surgery. Some of it has to do with genetics. These kinds of things can run in families. Sometimes it's just purely random. So there doesn't always have to necessarily be a cause, but we're here to validate you that these are real problems and something we can help with. So just some background science. I think this always helps to put things in perspective. How do things work? So first, the kidneys produce urine. They do that by filtering blood. The urine drains down the ureter tubes into the bladder. And the bladder's really only function is really to store urine. Otherwise, we would just constantly be leaking urine on ourselves as we produce it. So the bladder stores urine, and it has a very intimate relationship with the brain. Essentially, while the bladder is filling, while you're making urine, while you're running errands and not even thinking about your bladder, the bladder is sending signals to the brain to kind of ignore it, to not think about peeing, not have urgency or episodes or feel like you need to go all the time. And then once it reaches a normal capacity, it sends a signal to the brain that tells you, I have to pee. Then, what that does is it allows you to find a reasonable amount of time to find the bathroom and urinate, ideally without having to drop what you're doing immediately, find the nearest bathroom, pull over on the side of the road, whatever that may be. And once you're there in the bathroom, the brain kind of tells the bladder, okay, and the bladder squeezes and empties. Breakdowns of this pathway are where the problem occurs. The same thing happens with bowel control. Again, the rectum's primary role is to store stool. And so while the rectum is filling with stool, the brain and the body shouldn't really be thinking about it. But once the rectum is full and you get that sensation that you have to defecate, you have time to find a bathroom, not have any accidents, and empty your bowels. The three common problems we're going to be touching on today with urinary issues are below. So stress incontinence, urinary retention, and overactive bladder. And these may not be terms you've heard before, so we're going to go through them. What is stress incontinence? So it doesn't have anything really to do with stress. I think a lot of patients, when I first say it, say, yeah, I'm stressed. we all are stressed. I understand that. This really what it means is an abdominal stress. So it's whenever you increase your abdominal pressure, that pressure overwhelms your sphincter and your storage and you leak. So that's why traditionally patients will leak when they sneeze, cough, laugh, but it can also be with exercising, jumping jacks, bending, lifting, climbing stairs, really anything that again exerts pressure on the bladder. And we're not really going to talk too much on this. That's not really the focus of this talk, but I assure you, if this is something you're dealing with, please schedule an appointment with me or your urologist to discuss options, because it is definitely something we can take care of. Urinary retention. So this is when the bladder can't empty. A lot of patients think that they are emptying their bladder. The brain can play tricks on you, as can the bladder. So we have some tools in the office to actually confirm you're able to empty your bladder. A lot of times patients will tell me with overactive bladder, well, I just can't empty. And often that's not the problem. The problem is the bladder is so overactive that when you're going so often, you don't have much urine to pee. And so therefore you feel like you just can't empty your bladder, but that's not really the issue. However, if it is the issue where you're not able to empty your bladder, there are a lot of options for you. And so again, this is not necessarily the focus of this topic. Interstim is an option for many patients with urinary retention, but first patients need to have a full workup with their urologist to assess the underlying cause. So if this is something that you're dealing with as well, please schedule to see me and we can go from there. Lastly, and probably the focus of the talk is on overactive bladder. And again, overactive bladder has a number of different symptoms, but the most common are frequent urination, urge to go, and then urge incontinence, which is different than stress incontinence. Urge incontinence is leakage of urine associated with urgency, that gotta go feeling, just like in the old commercial. And oftentimes you don't make it in time. So it's associated with leakage, which if patients are using pads or diapers, we all know these are expensive, affect your quality of life, and are no way to live. What is fecal incontinence? So fecal incontinence, again, as we kind of touched on a little bit earlier in the science, it's essentially where you have the urgency to defecate or where you have incontinence. You actually leak stool before you make it to the bathroom. And so these can be very distressing. This can be a very distressing problem as well. So how can you find more control? There's really kind of three steps in our approach to overactive bladder in terms of finding what solution works for you. I always tell my patients when I see them the first time, I wouldn't be a great doctor if the first time I see you, I'm immediately, talking about surgery. So we may chat about it, but really I think it's important for you to understand there's a step process where we start with lifestyle changes, confirm that you've already done those, discuss medications, discuss their side effects, their limitations, and then also discuss what these advanced procedural therapies are. So lifestyle changes can occur in a number of different ways, but the most common are diet, exercise, bladder and bowel training, and pelvic floor strengthening. When it comes to diet, the biggest ones are caffeine. Caffeine is a bladder stimulant, and so often it will stimulate the bladder to be overactive. You can have frequency, urgency, and accidents associated with that alone. Like I said, a number of these other possibilities can improve your bladder symptoms without medication or surgery, but that's to be discussed in more detail with your urologist. So oral medications, often at our first visit, patients will say, well, I'm already doing all these things. I don't drink a lot of caffeine. I limit my fluids before bedtime, but I'm still really bothered. That's why I'm here. And so often we will try medication, but I always tell my patients with overactive bladder, there's not a perfect medication, and it's an unfortunate space where there isn't. And while it's still often necessary and encouraged to try medication, there are a lot of reasons why patients don't stay on medication. In fact, in a study, 72% of patients stop taking their bladder medication within 6 months. So it's a very common issue where patients will stop taking medications and maybe tell themselves, I guess I'll just deal with it. And again, we're here to say there are other options. There are two different classes of medications. Again, we'll go in more detail with this with you at your appointment, but there can be a lot of side effects: dry mouth, constipation, blood pressure issues, and then some of the newer medications that don't have generics that don't have these side effects can be very expensive. So sometimes, medication works great, and trust me, when it works great and you don't mind taking the medication, we're happy to continue on it. But I think it's also important that you have somebody that works with you and it's not just constantly pushing pills and telling you, just take the medicine. I think, you need to know that there are other options. One big thing with overactive bladder is patient attrition rate, meaning what is the rate at which patients just give up and don't follow up or don't do what therapy we've discussed with them. And it's very high. Again, I think that, it's probably a combination of factors, a combination of patients not wanting to talk about it, of being embarrassed to talk about it. It's a combination of there not being any really great medications that are covered by insurance and don't have side effects. And so really, again, this just emphasizes all too often patients just give up and say, you know what, I'm just going to deal with it. And again, we're going to talk about these a few extra options here. So when it comes to advanced therapies, the biggest one we're going to discuss today is the Medtronic Interstim system. And so that is a great option for both bladder and bowel control. One of the other advanced therapies, which is FDA approved and generally covered by insurance, is bladder Botox. And the first question people ask me is, whether this is going to be covered. Yeah, this is not cosmetic surgery like you would think with other Botox. But the way Botox works is it actually paralyzes muscle. That's how it works in the face. And so when it's injected into the bladder, we can partially paralyze the bladder and decrease the overactivity of the bladder. And that's why it's an effective method. However, there are some challenges. It has some relatively equal efficacy to oral medications. It's not really addressing the underlying source. Remember, that's kind of the nerve discrepancy, the nerve dysynergia, the nerves and the brain and the bladder not communicating correctly. It's really just hitting it at the muscle. And because of the mechanism of action that it paralyzes the bladder, there is a small risk that it could over-paralyze the bladder. And that's where you, the patient, may have to either self-catheterize or wear a catheter until it wears off. So that's often why this is not the first advanced therapy that we will consider, but it is a therapy that your urologist will discuss with you. Again, Interstim, the long word is sacral neuromodulation, again, because we're modulating the nerves in the sacrum. The sacrum is the bone at the bottom of the spine that has nerves that go through it that regulate your bladder. And so essentially, the way that this therapy works is it's like a bladder pacemaker. It's kind of how I explain it to my patients. There's a small, thin battery. You can see a picture of a couple of the batteries there that goes in the upper buttocks. And it basically controls the signaling between the bladder and the brain. So it's not bladder surgery. We're manipulating the nerve. Couple clarifying things. It's not spinal cord surgery. A lot of people ask me, is this going to make me paralyzed? There is 0% chance we can injure your spinal cord because it's not spinal cord surgery. We're affecting the nerves that are leaving the spinal cord before they go to the bladder. One of the really nice things about this is that you get to try it before you buy it. You know, essentially, you get to try it without us implanting the battery to see if it's a therapy that works for you. And that's just done simply with a little poke hole in the skin. No incision. You basically have a little wire coming out of the skin to a battery taped to the skin for a couple days for you to get to test drive whether this is going to work for you. And if you come back and say, this works awesome, I love it, then we get you set up to implant the entire thing. If it doesn't, then, you know, potentially no, you didn't get an incision or have something placed inside of you for no reason, and we can talk about Botox or one of the other options. Let's see, make sure I didn't miss anything. We do offer, with the batteries, there's rechargeable and recharge-free options. I won't get too much into that. That's something that your urologist or myself will discuss with you, but there are good options for each patient's specific priorities. I already kind of went through this. So this is just talking about the test phase where, you know, first we talk and then we get you set up for the test to see if this is a therapy that works for you. You see us back. This says up to 14 days, but most patients are in the 3 to 5 day range. And we call you usually every day, letting you, you know, touching base with you, seeing if this is helping, seeing if we need to adjust any settings. And ultimately, you see me to get the wires out, and we talk about whether this is something you want to move forward with. Really quick, for, you know, one of the big things that people ask about is whether this is MRI safe, because obviously we're placing something inside of you. It is MRI safe. And again, so you're asking yourself, is this therapy right for you? I can tell you that because you're on this talk, it's right for you to at least come chat with me about it. It may not be the exact next step that you need, depending on your situation, but Interstim is a great option for patients that have tried and failed simple changes in their lifestyle. Medications didn't work. Medications had a side effect. Medications were too expensive. You don't want to take medications. There's a lot of different reasons, but ultimately we're here to get you what you want, what you need. And again, just trusted proven therapy. I think the biggest number on here is that 89% of people using Medtronic experience long-term success. That's huge. Just a patient testimonial. This is Mitzi from Medtronic. She was a patient that got the Interstim and is very happy. One resource we do have, you can chat with a patient before proceeding. If that's something you're interested in, you just let your urologist or myself know. And at this time, I'll answer any questions. Last thing I'll say, you know, please make an appointment. We can discuss all sorts of issues that you're experiencing, bladder and bowel, whether it ends in, you know, something like an Interstim or not, or whether it's something completely unrelated. There's many ways in which you can schedule to see me. There's a number here. You can schedule, I believe, on the website. I believe also if you give your consent to be contacted, we'll also follow up with you to see if you'd like an appointment. So at this time, I will turn it back to Lauren to see if there's any questions.
All righty. Thank you so much, Dr. Lomboy. At this time, I'm going to open up another poll. If y'all will go ahead and just answer those questions for me. And then if you have any questions at all that you feel like you want answered, you can send them in that Q&A box at the bottom of the screen, and I'll read them out for Dr. Lomboy. But that other poll just launched, so if y'all will go through and just answer those questions real quick for me, and then I will go through and read some questions out for him. Let's see. All right. Well, we got a great job, Dr. Lomboy, direct and to the point. So great job. Thank you so much.
Thank you.
Also, a question for you. Is Interstim covered by insurance?
Yeah, so great question. And I did not touch on that. So thank you for asking. So we have a team of expert insurance specialists that will verify that this will be covered. The short answer is yes. This is an FDA approved therapy that's been out for many years. And so we will make sure that it is covered by your insurance. We have like I said, we have a great billing team that works honestly around the clock to make sure that you have all those questions answered and are aware of whatever out of pocket you may be liable for is brought to you before we do the procedure.
Awesome, thank you. And then one last question right now. How uncomfortable is the test or procedure usually?
Yeah, again, great question. I need to remember these questions to discuss these on the future one. So, most of the time we do this with you asleep. It's done in our surgery center. We place an IV, we give you mild anesthesia. Generally, you're not paralyzed, you don't have a breathing tube. So it's kind of similar to colonoscopy anesthesia. So really, you don't feel anything. We do have the opportunity to do these awake. You may ask why one would do that, but sometimes under certain situations, that's necessary. In general, you would be asleep. You don't feel anything during the procedure. Once you're awake, you're not in pain, especially with let's talk about these in parts. With the test, again, it's just a wire, so there's no incision. So you really do not have any need for pain control because essentially you won't have any pain. Once you're awake and lucid, Lauren or one of her colleagues will kind of turn the device on for you and discuss kind of what you should be feeling, what you shouldn't be feeling, give you numbers to call if you have any problems. But essentially, we'll turn on the stimulation and make sure everything is perfect before you leave the office. When you have the final device, the final Interstim placed, you do have a very small incision. It's probably about 2 inches in size. We numb up the skin. All the sutures are dissolvable. You can really pretty quickly return to your normal life. You just can't submerge the incision for a couple weeks. There may be a need for some very mild pain control, but most patients tell me they don't end up taking anything.
Awesome. Thank you so much for that answer. Well, I think that's it for the questions. If y'all will just finish up answering those poll questions for us. And then I believe that's it, unless anybody else wants to send any more questions in that Q&A box. But other than that, thank you so much, Dr. Lomboy, for your time tonight. And thank you everybody for joining this evening. Please feel free to jot down that phone number so you can call and schedule an appointment if you would like. And I hope everyone has a great night.
Yeah, thank you again for taking time out of your busy schedule to be here. And don't forget, we've recorded this. So if you need to, reference this at a future date or want to share it with somebody, just reach out to somebody at Advanced Urology. And I look forward to seeing you in the office.
All righty, everyone have a good evening. Thanks for joining.
Thank you.